Hello everybody. Today we are going to talk about the hemifacial spasm, about the diagnosis of hemifacial spasm, symptoms, and the treatment of hemifacial spasm. My name is Dr. Cameron Nagaev. I'm a neurosurgeon. So first of all, what is the hemifacial spasm? Hemifacial spasm is a disease characterized by sudden, uncontrolled, or involuntary twitching or contraction of the half of the face. So the hallmark of the disease that the only one half of the face is involved and it's uncontrolled. In order to understand how does the hemifacial spasm develop, we should understand the structure and the function of the facial nerve. So the facial nerve, which innervates the facial muscles or the mimic muscles of the face, is the only nerve that provides motor innervation to the face, which means it's a single nerve on one side with a pair of nerves, one on the left and one on the right side, that provide the innervation to the facial muscles. This nerve emerges from the brainstem, passes inside the skull, and then leaves the skull, divides into several branches that go to the different facial muscles from forehead all the way down to the neck, to the platysma muscle in the neck. So all facial muscles are innervated by the facial nerve. If there is some problem with the facial nerve that causing the nerve to generate abnormal impulses, those impulses, abnormal impulses, will pass along the nerve and then they will spread to the muscle, because the muscle takes the impulses from the facial nerve, which will result in uncontrolled twitching, contraction, or spasm in the area of the nerve, which is the half of the face. So how does the hemifacial spasm develop? What causes it? Well, in the vast majority of the cases, hemifacial spasm is caused by so-called neurovascular conflict. So, as I mentioned earlier, the facial nerve takes off from the brainstem and then enters the skull, goes in the skull and leaves the skull. After taking off from the brain and before entering the skull, there is a section of the facial nerve that is inside subarachnoid space. The space that surrounds the brain, this very narrow space that is around the brain, between the brain surface and inner surface of the skull. This space is filled with fluid, with the cerebrospinal fluid, and there are several other structures within that space, like vessels, like arteries, like veins. And in some cases, a vessel may warp, may turn around the facial nerve and cause the pressure on the facial nerve. In this case, the facial nerve will receive constant pulsatile pressure from the vessel, which will eventually form abnormal signals within the facial nerve, and those signals will be propagated to the muscles, causing hemifacial spasm. Tumors, cysts, virtually anything compressing the facial nerve may cause hemifacial spasm. In some cases, there is a mixture of facial palsy and the hemifacial nerve. So with a constant pressure on the nerve, the part of the nerve suffers. So the patient develops the palsy, so some half of the face is partially paralyzed. But the remaining muscles that are still working, they constantly twitching. So it's a combination of the hemifacial spasm and hemifacial paralysis or facial paralysis, simply saying. How is hemifacial spasm diagnosed? Well, in the vast majority of cases, the diagnosis is made by physical examination, simply looking at the patient's face. The hallmark of the disease is uncontrollable twitching in the half of the face. So the patient cannot control it. This twitching or contraction attacks can be triggered by laughing, by eating, by emotional states that cause the facial nerve to fire, and it will trigger or precipitate those attacks. These attacks are completely painless. There is no pain associated with this disease whatsoever, but they can be embarrassing for the patient. And the patients, that's why, seek the medical treatment. How is hemifacial spasm treated? Well, currently we have two treatment options for the hemifacial spasm. One is a Botox injection, and the second one is surgery. So Botox injection to the facial muscles is a very common procedure. In the vast majority of cases, it's performed for the aesthetic reasons, but not for the hemifacial spasm. Hemifacial spasm is an exception. When the treating doctor decides to do Botox injection to the face because of the facial spasm, he or she deliberately partially paralyzes facial muscles to achieve this effect, because the muscles receive the constant stimulation from the facial nerve, impeding with these impulses from the facial nerve to the muscle will provide the relief, and that's what the Botox does. However, Botox treatment is not permanent. It usually lasts no more than 6 months, and one of the significant handicaps of the Botox treatment is that it may leave the permanent facial palsy. With each consecutive Botox injections, there will be more and more permanent damage to the facial muscles. Another treatment for the hemifacial spasm is microvascular decompression, or MVD. It's a procedure of choice, which means that it's the best procedure that can be performed for hemifacial spasm. It works by eliminating the root of the problem, the cause of the problem, and that's why it has the highest success rate. And if it's successful, the success is permanent. Microvascular decompression is a procedure performed for the various diseases like trigeminal neuralgia, like hemifacial spasm, like glossopharyngeal neuralgia. Any neurovascular conflict disease can be treated with microvascular decompression. So it's not designed only for hemifacial spasm. It can be utilized for other diseases as well. In case of hemifacial spasm, the surgeon makes access to the facial nerve through the incision in the back of the ear, and makes craniotomy, which is the opening in the skull. So he works or she works through this window and goes through this window around the brain, around the cerebellum, to find the facial nerve. Once the facial nerve is exposed, we explore it with a microscope, with a magnification and illumination of the microscope, and then we find the vessel that is causing the compression of the facial nerve. We separate the vessel from the nerve, and we place an artificial material, usually between the artery and the nerve, so there will be no compression in the future. So this small pillow of material, usually Teflon is used, is basically keeps these two structures, vessel and the nerve, apart, so the vessel cannot compress the nerve again, and that's why how the hemifacial spasm is surgically treated. So today we discussed hemifacial spasm. Thank you very much for watching this video. You can always find more information on our website. Thank you.